Okay, so like I said, I am Dr. Jeffrey Parr. I am the program director. Um, so what we're going to talk about today, we're going to look at some basic program information. We're going to talk about your potential clinical experiences in our program. We're going to talk a little bit about the research requirement and how that works as part of our new program. Then we'll finish up with how to apply. And most importantly, what's this program going to cost you? So when you look at the program, we are a 2-year, 6-semester plan. We run summer, fall, spring, summer, fall, spring. You can see we have a list of prerequisites here. It seems quite lengthy, but these are common prerequisites for athletic training. So no matter what university you're looking at, you're probably seeing most of these on here. Now, with this being our first year, we've actually been given a waiver. If you do not have one or more of these prereqs by the time you start the program, you are allowed to take that course at the undergraduate level as what's called a co-requisite. So you would take it at the same time that you're taking your graduate courses at, of course, an additional fee to you, but it wouldn't hinder you from applying to the program like it may in future years. So that's something we've been able to work out this year, being the first year in our program. So if you are missing one or two or of these courses, don't be afraid to apply. Reach out to us. We can kind of discuss the options and whether it's feasible. There are a few classes that are kind of non-negotiable. You do need to have at least Anatomy and Physiology 1 to be able to apply. Without that, you would come in and just be so far behind, it wouldn't be fair to you. So other things that you need to apply, you need to have a minimum cumulative collegiate GPA of 2.8. So wherever your primary bachelor's degree is from, if you've taken courses at community colleges, junior colleges, other 4-year universities, we look at all of those GPAs and that cumulative score needs to be above a 2.8. The university does typically require GRE scores. Because of COVID, the University of Southern Miss is waiving GRE scores for programs that are starting this summer or this fall. So that includes us. Other things you will need to submit with your application, a resume, a cover letter, 3 writing prompts. And these writing prompts, they are 300-word max. They are, why do you want to be an athletic trainer? What unique qualities can you bring to our program? And then where do you see yourself professionally 5 years from now? So pretty simple things, but we just kind of want to be able to get a base on who you are and kind of your expectations and what you're bringing to our program. The next thing is we do have a 100-hour clinical observation requirement, with most of those needing to occur under a certified athletic trainer. However, with COVID, we are allowing some flexibility in this. We understand that not everybody is accepting observation students because of the risk of COVID, and that may make it hard to get your observation hours. So if you are limited in your observation hours, again, feel free to apply, but reach out to us so that we can discuss that beforehand. And then the final thing you'll need is 3 academic/professional letters of recommendation. And one of those will need to come from a college or university individual. So looking at our program layout.
Dr. Parr, we have a question in the chat.
Okay, sorry, I'm not seeing the chat while I'm sharing my screen. So let me go over to that.
That'll give me appropriate to answer it now since it's pertaining to classes.
Yeah, so, okay, here it is. It finally pulled up. Would kinesiology fit into biomechanics? That's a great question. It could potentially, and it may just be that I need to see the syllabus. So as the program director, I have a lot of flexibility in what I can count as a prerequisite for what courses. So every school kind of labels things a little differently. Um, so if you think that your course may cover or count towards a certain prereq and it doesn't have that specific name, biomechanics, send me a syllabus and we can, discuss, is this an appropriate content course that covers this information. I just keep all of that information in your file so that if we ever get audited, we have proof that you've actually taken the biomechanics class. So thank you for that question. That was definitely a good one to cover. So now looking at our program layout at the master's level. So you can see we start academic year 1 in the summer. A lot of your classes are going to be, introductory level, foundational type courses. We do have 2 lab courses. One of them you will primarily be doing, entry level taping skills, wrapping, bracing, padding, things like that. Emergency management, and then the lab. This is where you're going to learn to, spine board, splint. We will certify you in CPR. You may be certified already, which is fantastic, but we need to make sure that you have the correct certification. So we certify everybody, and we pay for that as part of your course fees. And then the last course in this summer is Advanced Kinesiology. The name of this course may actually change. We are working with the School of Kinesiology and Nutrition to kind of figure something out that better represents what this course is. But what this course is it's a applied functional anatomy course. So a lot of your time is spent in a cadaver lab looking at dissected models. So you're not actually doing the dissection. So it's what we call prosection. You're getting the opportunity to look at human anatomy and really see it kind of firsthand without having to do the tedious cutting and pulling away and cleaning of everything. So your time in there is spent actually learning and really delving into the human anatomy. Then if you start kind of looking through the rest of our semesters, you'll see they're going to be fairly typical of most programs. We start teaching you the core athletic training material, how to do an evaluation, how to do rehab. And then within this, we also start our research related courses. So Dr. K will talk about research in a little bit, but we try to each semester give you a little bit of information and help you work on a project or thesis so that by the end of your 6 semesters in the program, you're ready to present a project that you've completed that you've really been working on in classes. The benefit we have here, and one of the things that we can do through another collaboration with 2 of the schools over in nursing, is we can get over and use their simulation lab. So we get in and we can look at using these mannequins. They can alter blood pressure and heart rate, makes it easier to monitor. They have mannequins that do a whole bunch of things. So we're working on, how do we integrate this lab into our courses? So this is something that we are looking at and expanding the use of with our program. So now Dr. Oglesby will actually talk about clinical experiences.
Okay, so one of the unique things about athletic training that we've been doing for a very long time is, well, while you're going through a program for athletic training, you are not just sitting in a classroom all day long and learning about skills. You're getting to actually go out to clinical sites and apply those skills as you learn them. This is something that medical models have been working towards and other healthcare professions for a while. We've been doing it for a very long time. And so we're going to continue that with our master's program. So beginning your 2nd semester in the program, that first fall semester, you will start doing clinical experiences every semester. And what that looks like is you being assigned to one site per semester. It could be an on-campus sport at Southern Miss, or it could be an off-campus site. And we'll look at some of those on the next slide in a minute, where you might go. And again, it changes every semester. And so you'll spend about 3 months ish, 3 to 4 months at one site working with a small group of certified athletic trainers who will be your preceptors. And you'll be taking skills you've learned in class, applying them in that setting with that preceptor watching and guiding you, and just basically perfecting your craft so that when you leave our program, you have 2 years of experience under your belt. You've been doing this for a while, and you're not just walking into your first job not knowing what to do because you've never actually done it before. And so this will be showing when you leave again that you know what you're doing, and you've shown that for a couple of years already. There will be one small exception to our normal rotations, which is that second summer, you'll do what we call mini rotations. And so because most of our on-campus sports are either completely inactive or relatively inactive during the summer months, we'll do some smaller rotations with physical therapy clinics, our on-campus student health center, some off-campus sports medicine facilities with sports medicine physicians. You'll be doing smaller rotations on about a 2 to 3 week basis at different sites, just getting some experience with different healthcare settings and working with different healthcare professionals. And then once we come back for that second fall semester, your 5th semester of the program, we'll go back to that normal clinical experience. Now, that 5th semester, that second fall, we'll do something also a little different called clinical immersion. And what that means is for the other 3 or 4 semesters that you're doing that clinical experience, you're also be doing classes in class, right? You'll be taking classes at the same time. Clinical immersion is going to be a period of time where you won't be having any classes in person. You may have 1 or 2 online classes, but that's it. And in exchange for that, you'll be getting a true day in, day out experience with your preceptors, seeing this is what they do from beginning to end every day. And so you're getting a real true experience of this is what it's like to really be an athletic trainer with no classes attached, not having to go to class in the meantime, but from the day, when the day begins to when it ends, here's what they're doing. You're with them doing it as well. And so it gives you that really true immersive experience. And right now we're looking at that being the entire fall semester. And so you get a true 3 to 4 months of this is what it is really like. And so it's a great experience to see not just what happens at practice, what happens with treatments and rehabs, but what about scheduling doctor's appointments? What about going to those doctor's appointments with your patients? What about talking to parents and coaches and having meetings about the health of the team? Those things that tend to get done when the students aren't there. And so you get to see what that's really like and get more hands-on experience with that. So our next slide is going to show some of these on and off campus experiences that we have. So we have approximately 20 sites that we can send students to right now. And between those sites, we have roughly 30 certified preceptors that are all licensed, most of them licensed and certified as athletic trainers, some of them being licensed certified as physical therapists or physicians, nurse practitioners instead. But you can see how that may vary based on what the site is. So on campus, you can see we have Southern Miss football, baseball, softball, indoor and beach volleyball, track and field, women's soccer, men's and women's basketball, men's and women's tennis, and then our student health center. Off campus, we have William Carey University, which is a local NAIA private Baptist college right here in Hattiesburg. We send about 2 or 3 students there every semester to work with all of their sports. So you get that experience of what is it like to work as a group of maybe 2 or 3 certified athletic trainers working with 20 plus sports, which is very common at smaller universities. We also have several high schools in the area, Hattiesburg High School, Oak Grove, North Forest, Purvis, and Petal. These high schools are all within about 15 to 20 minutes from our campus, and they are all very different in terms of size, student demographics, things like that, number of sports that they have available there because of the size of the school and the student demographics. And so there's very different experiences at each of these sites as well. Also in the area, we have a very large medical group called Hattiesburg Clinic, and we send students there as part of their mini rotations for their sports medicine group to work with their sports medicine physicians to see what it looks like in a day for them. We also expect our students during that mini rotation semester to do at least 1 ambulance ride along. And what that means is you do 1 12-hour shift on the truck. And wherever the crew goes, that's where you go. And you get to see what it's like in a day in the life of somebody working on the ambulance crew. And so it's a really great experience our students love. And then also we have a local physical therapy clinic where you get part of your mini rotations. We are looking to expand both our general medical rotation. Right now it's just Student Health Center on campus. We're looking to expand that. We're also looking to expand our physical therapy sites so we can get a bit more diversified experience in that. And we're also looking to expand our clinical sites otherwise. It's not officially official, but we are working on paperwork to get a local community college to become a clinical site for us. So it used to be Jones County Junior College. Now they're just called Jones College. We're in great communications with them about adding them potentially for the fall as well. And so we'll have that junior college or community college experience also. So you can see again what it's like to work a whole lot of sports when there's just one or two of you, as opposed to working at a large university like Southern Miss, where you may have one or two certifieds working at each sport. And so it's a different experience. It's a different need based on what you want to do as a career. And so as you go throughout our program, we'll ask you a couple of times at different points, what are you leaning towards? What are your career goals? Do you want to work in the collegiate setting, in the high school setting, in the junior college setting? And the kind of answers you give us helps us dictate where we should place you for your clinical sites, because we want to get you the experience that's going to help you be the most successful. At the same time, I also have to make sure that your clinical experiences check a lot of boxes. And what I mean by that is our accrediting body makes us assure that our students are getting a well-rounded clinical experience. So at some point during your time in the program, you have to go to an equipment intensive sport, which for us basically means football in South Mississippi. You have to go to a men's sport and a women's sport. You have to go to a team sport and an individual sport. You have to go to a high school at some point. And so these are just boxes we have to check at some point while you're doing these clinical rotations. Now, some sites will check multiple boxes, and that's fine. But at some point, you have to get that well-rounded experience while also making sure we're getting you the experience that's the most beneficial for you and what you want to do. And I think that's all I have on clinical experiences.
So I would add one thing to that, Dr. Oglesby. A lot of our preceptors at these clinical sites are graduates of our program. So they truly understand what you are going through as a student here. They understand what you need and really have a vested interest in making sure that you do well. So it's not a scenario where you're going to be thrown off at a high school or at some on-campus site and they're just going to look at you as a workhorse. Our preceptors truly understand what you need as a student to be successful upon graduation, and we work as a team to make sure that happens.
Yes, thank you for mentioning that, because like you said, most of our preceptors are alumni of our program. They love our program. They want it to succeed, which means they want you to succeed. And in order to do that, they have to, right? They have to pour into you. They have to be not just a preceptor, but an advisor, a mentor to you, to make sure that you're doing the things that you need to do and do them right and do them well. And so they're definitely going to pour into you. I would never send somebody to a site that I did not feel would be beneficial to you. And so if I were to send you somewhere where I thought you were not learning, I would pull you out and put you somewhere else. I have great relationships with all of our preceptors. There's not a one of them that I am cautious or iffy about sending students to.
Okay, Dr. K.
All right, so I get the fun job of talking to you all about research, which can be a really scary topic for those of you that have never done research before. I was one of those students as an undergrad that I had never touched research. And then I went to graduate school. I had to do a research project and I ended up falling in love with it. So my job is to make sure that you all fall in love with it too, because it sounds scary, but it's not that bad. So one of the things that's unique about our program is we provide this opportunity for you to do research. And really the goal of it is to better the profession of athletic training, because by doing this research, you can answer a question that you see in your clinical environment. You can change the standards of care and change sort of what's happening with our patient population. And by implementing that project and collecting the data and analyzing the data, you can basically tell other athletic trainers what you learned, which can improve patient care. So that's why we do research, and research is so important. So here at Southern Miss, you will complete a capstone project. That is a 2-year process where you will work with a faculty advisor. And like I mentioned, you will design a research study, collect data, analyze data, and interpret it. And you'll also create that dissemination of it. So you'll tell other people what you learned. So while that is a 2-year process, it is something like Dr. Parr mentioned, we have weaved into the coursework for this program. So it's a little bit less daunting. So Dr. Parr, if you'll move on to the next slide for me. So like I mentioned, evidence-based, or like I mentioned, research is really important for athletic training because it helps us acquire new knowledge. So we use this paradigm called evidence-based practice, where we ask a question, we figure out some new information, we determine how good that information is, and we apply it and we test it. And so evidence-based practice really relies on research, but also our clinical expertise and also the values of our patient to come to some sort of agreement about optimal healthcare for them. So go ahead and move on. So like I mentioned, in class specifically, we will really focus on helping you design these projects and helping you succeed related to research. And one of the areas in which we'll do this during class is by appraising evidence. And what I mean by appraising evidence is that when we actually look at research, we have to know how to read it, what it means, what to do with that information. And so we'll practice those key concepts as you are going through the process of designing and collecting your data. So in particular, you've got one class called Research Design and Statistics, which sounds super scary because statistics can be daunting. It's not meant to be that way. It's actually really focused on that evidence-based practice concept. So you'll get an introduction to research, and then we'll specifically dive into some different types of research. So quantitative research is all about the numbers. So how much of a problem is something, or how bad of a problem is it? And then we also will dive into a little bit of qualitative research, which are the people behind the numbers. So why does it matter? How do we make it better? Those types of questions. And then we'll also talk a little bit about mixed methods research, which is where you take the numbers and you take the words and you put them together and say, okay, this is a bad problem. So now how can we make it better? So the combination of the two. So within this research design and statistics class, we will look at lots of different information about different topics. You'll find a topic that you like and that interests you, and we'll work with you to pair you with a faculty advisor that's in that realm that you're interested in, because the last thing we want you to do is pick a research topic that you're not interested in. It can be a lot of work. And so if you don't enjoy it, it can make it not so fun. So we want to make sure that you're enjoying the process. So some of your options in terms of those faculty mentors are the three of us. So Dr. Oglesby specifically specializes in burnout and specifically related to occupational burnout. So basically how much is left in our tank as athletic trainers. And he does this using a lot of survey research approaches. Dr. Parr specializes in injury prevention and has a background in exercise physiology. So he looks at what are the most common types of injuries and how can we keep them from happening. And he does this a lot of the time through lab-based research. And then me, I specialize in concussion and issues of sport culture. So more of the why do people behave the way that they do. And I do this primarily through mixed methods. So I take that survey information and I take interview data. So I have the numbers and the words to support those. But this is not the end all be all of your options when you come to Southern Miss and do research. We have collaborations with faculty across campus in kinesiology and sports psychology, and we're open to developing new collaborations and new connections. So if there's a particular topic that interests you, you just have to make sure you let us know so we can find somebody that can best help you.
So that kicks it back to me. We're going to talk a little bit about what the application process looks like. So the first thing you need to do is create an account through the USM grad school webpage. After you do this, to submit an application, there will be a $60 application fee. On the webpage, it'll tell you everything that you need. Part of that is the technical standards. All you do on this is you download it, you sign it, upload it, and then resubmit it back into your application. Once your application is complete, we, the faculty, review your application and score it for merit. And then you may be required to complete an in-person or virtual interview. And we can do whatever best suits you, and whatever is easiest at the time. And I've put the web page with all the admissions requirements on it for easy access. The deadlines, obviously we've already passed the priority deadline, but not an issue. The final deadline is May 15th. We accept applications on a rolling basis until we've filled up the number of slots that we are filling up for that year. In a traditional year, we will accept anywhere between 18 to 20 individuals. In this, our first year, because there's going to be some overlap with our last undergraduate class, we were expecting our numbers to be on the low side. So we do have a more limited number of spots available for this year. So if you are interested in applying for our program this year, I would suggest doing that as soon as possible, reaching out to us if you have any questions, so that we can go through the process and see if you are a candidate who we would want here, and it gives you the opportunity to see if this is a school that you would even want to go to. So at the end of kind of all that, we have three options for how we can handle people we've interviewed. Obviously, we can accept you outright, which if we do, we'll send you a letter telling you so. We can put you on a wait list. Okay, so wait list just means we see you as satisfactory, but we have a lot of other candidates that we are currently still interviewing, so that we are, we're seeing where we fall after that. And then obviously we can deny somebody. If we do not feel that you are the right fit for this university, we will let you know up front. So when you're looking at Southern Miss, the question is, why should you come to Southern Miss versus going somewhere else? And we've talked about this as faculty quite a bit lately. And I think one of the top things is we provide a family-friendly atmosphere. Our students in the program, every single one of them probably has at least one of our phone numbers, if not multiple of the faculty's phone numbers. When you come here, we don't want you to feel like, you're in class and once you're out of our lives. We're here to help you whenever you need it, with whatever you need. We want you to feel like, this is family and that you are taken care of while you're here at Southern Miss. As Vince previously mentioned, we have partnerships with other schools that allow for a variety of educational resources that not a lot of other schools are going to be able to offer. So our simulation lab with nursing, our cadaver lab with the School of Kinesiology and Nutrition, and then as Dr. K had mentioned, collaborations for research across campus. We have small class sizes. This is going to allow for a lot of hands-on practice. So even in a non-traditional year, we are only looking at accepting 18 to 20 students. And we do that to make sure that at clinical settings, you guys are getting a good experience and not being overwhelmed. And there's just so many students there that you're not really getting to do and practice these hands-on things. Southern Miss, we have 40 years of athletic training education under our belt. We have been producing athletic trainers into this profession since the 1970s. So we know what we're doing, and we continue on a model that was initially built back in the 80s and 90s by Jim Gillespie, who is a National Athletic Training Association Hall of Fame member. And he was entered for his educational practices. And then last, and probably most important to you guys, is we offer competitive in-state and out-of-state tuition costs. So if you look here, if you're just coming in and all you need is graduate courses, so you don't need any of those co-requisite courses that we kind of talked about. Every semester, we fall in that 9 to 13 hours per term schedule. So your total tuition rate with fees is going to be $4,448, and that is in-state tuition. If you are a non-resident of Mississippi, there's an additional flat cost of $1,000. Okay? So I did some quick math on that earlier. If you were an in-state student over 2 years, the total cost of the program is going to be a little bit over $26,000. If you were out of state, the total cost will be a little over $32,000. Which, if you're not from Mississippi and you start looking at programs within your state, you're going to find that we are competitive with their in-state tuition. And then obviously we have a lot of scholarships that we can offer. Our athletic foundation has several scholarships specifically to athletic training students. And these scholarships are not huge. They're $500 or $1,000. But then you have scholarships through our state organization, our regional organization, international organizations. And if you're applying for multiple scholarships, these can start to add up and significantly reduce your overall cost within the program. So that kind of ends our presentation for you. If you guys have questions for us now, we will take them. We'll take some questions, or we'll give it a minute and then stop recording the presentation in case you are just not comfortable asking a question while we're being recorded. So I'll give it a minute and see if we have any questions, and we'll go from there. And again, if you do not have a microphone with your computer, please feel free to type your question into chat and we can see it that way. So I will stop the recording at this point and we can continue the discussion for as long as you need.